So I wanted to talk about a big topic that comes up in the office quite a bit about self cracking, as people like to say, or self adjusting. A lot of times when patients like to do this, they say they get some relief from it, but more times than not, that pain or discomfort or whatever it is that they feel in the area that they're self adjusting comes back. And so basically, what's happening when we talk about the spine and we talk about that adjustment that happens or the crack that happens, basically, the spine, when you do that and you do it repetitiously, like people love to do, it takes areas of the spine, it makes them hypermobile. So there's multiple joints, whether we look at the neck, we look at the mid back, or we look at the low back, there's areas of the spine that become hypermobile or joints that become hypermobile, but then there's also joints that become hypomobile or less mobile. And so when you see a chiropractor, those hypomobile joints are the ones that we're actually looking for. Because if you find yourself adjusting yourself on your own and you're not getting that relief, it's because those hypomobile joints aren't moving and you're just getting more excessive motion from those hypermobile joints. And so that's why a lot of times I tell patients it's not as effective as seeing a chiropractor because we're looking for the underlying hypomobile joint that needs to be released and needs to move. And so, is it bad? Is it good? I would say it's more on the bad than good side, but it's not really going to cause a big issue if you find yourself, unless you find yourself doing it a lot of times throughout the day. But that's where I would say if you can, try to find a chiropractor that you feel comfortable with that can evaluate your spine, find those hypomobile joints, and get them moving. And you're going to find yourself wanting to adjust yourself less and less.